Secretary Dr. Maria Rosario Vergere. ASEC, welcome to the show. Thank you for joining us.
Good morning, Pinky.
ASEC, so right now, latest reports is that we have 10 confirmed COVID-19 cases.
Yes, that's right. We have 10 confirmed COVID cases here in the country.
All right. There is a suspected case in Quezon Province. Any news on that patient under investigation?
We still do not have that information yet, Pinky, though we are monitoring one person now as based here on our report, admitted as patient under investigation in that area in Calabarzon.
Yes, that's the one that came out in the news 2 days ago, ASEC. There's also an announcement. There was an announcement of a positive COVID case in Quezon City.
That's already part of the 10 persons that we are talking about.
I see. Which one is this this patient from Quezon City? Is this number 10? Patient number 10?
Admitted in this Quezon City, the address would be the hospital's address, Pinky, and not the address of the person.
Yes, that's right. So the QC one is part of the 10 that was announced by the health department, just to be very clear on that. I wanted to ask the situation. Of course, it was last Friday, ASEC, where the Department of Health also announced the additional cases. You know, we had 3 and then a lull, and then the next 3. Let me go to the employee in BGC. Do you have any idea, ASEC, how this person is?
He's now in stable condition. That is our 4th case, case number 4. He's now in stable condition, currently admitted in our referral hospital, and he is being monitored properly there.
What about the contact tracing of this person, this male?
Yes, contact tracing is undergoing. We have already started with the initial list of contacts during the night that he was detected as positive. And now we have expanded contact tracing to all the other contacts that had been identified. Maybe later this afternoon, we will get a partial report from the contacts traced from this 4th case of ours. And maybe also we will get laboratory results already because we have submitted laboratory as early as Friday afternoon.
From those this person came in contact with, ASEC?
Yes, ma'am.
I see.
Yes.
So swab tests were already taken from the possible suspected cases, at least those contact traced by this male in BGC.
Yes, actually, for all the cases that we have right now, for all their contacts that we have identified, we do immediate testing. We do the swab testing and get their specimens so that it can be subjected to laboratory processes.
I understand that this, you mean, obviously would be the 5th and the 6th patient as well.
Yes.
Opo. You know, there was a tweet by Senator Win Gatchalian. He said this, ASEC, in a way he was saying hindi daw siya makatulog dahil daw because of the San Juan COVID patient contracted the virus without travel abroad. So this is the 5th one. Ito po yung sinasabi ng local transmission, ASEC. So what the senator is saying, so he got this from someone who already had the virus. And what he says is that that person is still out there unknowingly spreading the virus. Can you react to that, ASEC?
Yes, ma'am, because we all know that the transmission of the virus is through droplet infection. It can be transmitted even with just mild symptoms of the disease. So maybe one of the assumptions or the theories that is being studied right now would be for this person, he got the disease from another person who did not know that he had COVID-19. That's why we are doing intensified contact tracing right now, especially for this 5th case, because we know that he did not have any travel history at all.
Yeah.
And we are extending this contact tracing even to his secondary contacts that we identify also.
ASEC, can you explain it to me? How difficult would it be to actually find the source of the COVID-19 of the 5th patient, the one of the local transmission?
Well, it's quite difficult because we need to find all of his contacts and we need to identify who among them was the index case and not this person that we are talking about. When we say it's the index case, it's the primary person who has exhibited or who has that COVID-19 and has spread to the others. So we are trying to find out where it really originated.
Yeah.
So it's quite difficult for us because there is a list of persons that we need to go and find and check and get all the histories and do the testing.
Nahahanap ho ba talaga yung index case?
Hopefully in this person, with this person, we will be able to do so that we will know how it has originated.